Welcome back, everybody. The Fentanyl Abatement and Suppression Team is a joint effort by the U.S. Attorney's Office and Homeland Security Investigations, as well as other law enforcement agencies, to target fentanyl being trafficked through our southern border and into San Diego County. Joining us now to further discuss this issue, Marissa Veron, the Executive Director of the McAlister Institute. Marissa, good morning. Thanks for joining us.
Thank you so much for having me.
Let's start with the McAlister Institute.
Absolutely. So we were founded in 1977, and since then we have been providing substance use disorder treatment services for San Diegans. We have care that ranges from inpatient all the way to outpatient programs, and we serve about 20,000 people per year.
Okay, and you were telling me off camera that you had a chance to be a part of kind of a roundtable.
I did, and it was really amazing because it was all branches of law enforcement, prosecution, and I think what was so important is that we were there representing treatment. So many of the efforts were focused on abatement, suppression, and really the supply side, but I think it was so important that we were all coming together, acknowledging that this was going to be an all hands on deck and that treatment was part of the conversation. Because as you probably know, supply alone is a very important component, but so is demand, and making sure that we have treatment and support available for individuals who are struggling.
When we think of the McAlister Institute, we usually think of alcohol addiction and various types of drugs, but fentanyl, how many cases are you treating right now, or do you even know?
We do. So about 700 people last year that we served had fentanyl as their drug of choice. So I think we hear a ton in the media about fentanyl poisoning, which is incredibly important, especially among our youth. But it's also really important that we're talking about folks who are choosing this as a drug of choice, and that we're talking about the lethality of it and making sure that treatment's available for everyone.
It used to be the real demon was crystal methamphetamine. Has fentanyl kind of taken its place?
It has not. Meth is still the #1 drug of choice that we see, but fentanyl is certainly growing in prevalence. And we're also seeing that even the meth supply is tainted with fentanyl. And so a lot more polysubstance use. It's really ugly out there.
Is fentanyl cheaper?
It is.
It is. That's part of the problem, isn't it?
It is, and that's why it's so important to be part of initiatives like this roundtable, where it's, again, law enforcement, prosecution, healthcare providers, and it's an all-hands-on-deck effort.
So what would you say to somebody who knows somebody who's using fentanyl and they want to get him some help?
Well, I would say that we need to make sure that our access and door to treatment is as wide as possible. I would make sure that everyone, whether you know a fentanyl user or not, has Narcan in their house. Sometimes it's also called naloxone, which might be the way that you hear about it. San Diego County has vending machines all over. It's now sold over the counter, and it can help prevent fatal overdoses.
I carry it with me everywhere I go.
That's so good to hear.
Yeah, you need to do it. Put it in your backpack. That's what I do.
It should be as common as a fire extinguisher.
That's very well put. What is the best course of treatment for somebody who's using fentanyl? When you find out somebody's using, they want to get off of it, how do you go about treating it?
Well, McAlister has, for a very long time, provided evidence-based practices that range from counseling, and we're really moving into a more integrated approach where we're starting to provide medications for assisted treatment, medications for addiction treatment, which is a very important and evidence-based practice that is bringing together therapies as well as medications to support folks so that it's a more comfortable experience, and that we're helping to prevent future overdoses and suppress the cravings.
What are some of the signs to look for if somebody suspects someone of using fentanyl?
Well, I think the most important thing, again, is that we are ensuring every household has naloxone, that the door to treatment is wide open, and that we're having conversations with people, especially our young kids. I'm sure you've heard, but there have been accidental overdose deaths, and we need to make sure that we're talking to kids about the dangers of buying pills on Snapchat, around taking anything that they don't know where it came from when it's not prescribed, and making sure that we all know our resources that are out there.
Okay, is there anything else you think our viewers should know as far as the resources and what you guys do?
Well, absolutely. So McAlister is very unique, and our founder and CEO, who's 91 years old, is probably the most committed person to access that I have ever met. And she actually gives her personal cell phone number. So if anyone is looking for help, they can call 619-987-6393.
Okay, and do you have a website they can go to?
We do, McAlisterinc.org.
McAlisterinc.org. All right, Marissa Vaughn, thank you for coming. And congratulations on your engagement. She got engaged last night.
Thank you so much.
Congratulations. Thanks for coming in. We appreciate the info and all you do.
Thank you so much for having me.
All right, still to come on Good Morning San Diego.